Hello. We represent the superintendents of the Franklin and Grand Isle counties. We are working very closely with one another in order to develop our school reopening plans.
More than anything, we want our students back in school, learning in person from their teachers and being with their friends. In order to do this, we must follow Vermont's strong and healthy start guidelines. Our first priority is the health and safety of our staff and students.
We've asked local health providers to share the 3 big ideas included in our reopening plans and help students, staff, families ease the transition back to school.
Hi, I'm Amy McGentrick.
And I'm Jess White.
And we're healthcare providers at the Champlain Islands Health Center in South Hero.
We want to make sure that you and your friends understand why it's important to wear a mask and how to wear them properly.
It's recommended that you wear masks when you go back to school to stay healthy and to protect others around you.
Sometimes people don't know that they have the coronavirus because they don't have symptoms.
That's why you need to wear a mask, even if you don't feel sick. It helps keep you and your friends and everyone else around you safe, just like they're keeping you safe by wearing their own masks.
A mask and frequent hand washing helps keep the germs from your nose and your mouth from spreading to other people.
Your mask should cover your nose and your mouth and be comfortably fit behind your ears. Try to find a few masks that you like, with fun prints maybe, and practice wearing them before school starts. Thanks, and have a great rest of your summer.
Hi, my name is Deanne Haig, and I'm a pediatrician from Franklin County. I'm here to tell you that your school nurses and administrators have been working hard this summer with community members and other healthcare professionals like myself to plan a safe and healthy return to school this fall. So much has changed in our world since March, and our return to school will understandably be different. In addition to hand washing, wearing facial coverings, and practicing physical distancing as we have become accustomed, schools will be asked to perform daily health checks at the time of bus pickup or student arrival to school in order to reduce the spread of illness. You can help by performing a health check of your own at home before leaving for school simply by taking your child's temperature if you have access to a thermometer and answering some screening questions provided to you by your school or on a symptom checker app. Your school will provide you with guidance about which tools they would like you to use. If you do find that you have a fever or answer yes to any of the screening questions, please stay home. Drink plenty of water, rest, and call your school nurse or doctor for advice about when it is safe to return. We understand that not all illness is COVID-19, and these measures may feel extreme, but by reducing the exposure to infection in general, we reduce the number of missed days for all students. We also understand that certain chronic health conditions such as asthma, allergies, and inflammatory bowel conditions may cause overlapping symptoms and make the screening questions difficult to answer. Please speak with your school nurse or healthcare provider about what changes in your symptoms to watch for and when it might be best to stay home. With your help, we can have a safe and healthy return to school and move forward with our learning. We're all in this together. Go Team Franklin Grand Isle and go Team Vermont.
So originally with COVID, we were told to social distance. Now we're being told to physical distance since socially we are starting to be with each other. So the difference really is socially distancing means you stay home. You don't go out in crowds. You limit your exposure. Physical distancing is quite different now. Physical distancing is more of a measurement. It's a 6-foot measurement from you to the other person. That always isn't easy to do. So in school, we're doing the best we can to create distance between people. And what that may look like is creating distance between chairs and where their chair lies and where your chair lies, 6 feet. We're also trying to make indicators on the floors so people know where to stand, right here and right here. You're not always going to have a perfect setting, and you're not always going to have reminders as to what 6 feet is. So it's important to do something in your mind that you can quickly remember. Possibly 2 arms lengths away, possibly the equivalent of a door. There's many different options, so I would make it something personable to you as a reminder. And when in doubt, take a step back. It's okay. We're doing great jobs by washing our hands, keeping our masks on at all times, and trying to keep as much distance as possible. So I'm thinking that we will be safe this year, and we will be able to be socially together.
Each of us is working with our teams to finalize our reopening plans. We will be sharing more information with our respective stakeholders throughout the rest of the summer.
We're excited to have our students and staff back in our schools. We can't wait to have you all back. See you soon.
Masks on, Franklin Northeast.
Masks on, Missisquoi.
Masks on, GISU.
Mask on, Franklin West.
Mask on, Maple Run.